Well, whether you're using a homemade mask, scarf, bandana, or surgical mask, one of the most important steps before putting on or after taking off a face covering is to use appropriate hand hygiene, either by using hand sanitizer or washing your hands with soap and water. We've heard that all the time. Well, joining me in the studio for more on face mask hygiene and other issues around COVID-19 is the chairman, Medical Subcommittee, FCT Ministerial Expert Advisory Committee on COVID-19, Dr. Ejike Oji. Thank you very much for joining us, Dr. Oji.
Thank you for having me.
Now, what can you tell us about some of the issues revolving around the use of face mask by Nigerians, especially from your observation as an expert?
Yes, the guideline came out from WHO years ago. Initially, the world didn't know that face masks were very, very important. It was only meant for health workers within the hospital's premises treating COVID-19 patients. So it wasn't encouraged to be used widely. But as the science evolves, we now found out that the face mask was very, very important because of the droplet-like infections. So that was why face masks now became almost like the vaccine that we haven't seen. Not only that the face mask protects the person next to you, it also gives you some level of protection. And there are different types. And then the new WHO guideline, also NCDC, specifies that surgical face mask, the type I'm wearing now, should be worn by people 50 and above when they go outside of their premises and they're going to mingle. And then for people less than that age, they can wear a cloth mask, but with 3 layers. So that is the standard system. But the important thing in terms of wearing the mask can be as good as it could be bad. If for any reason you're wearing your mask, when you want to remove it, you need to remove it from the side. You can see what I'm doing? You remove it this way. You don't touch the front part of the mask. The reason is, as you're breathing, the viruses, if you have it in the room, they are settling in front of the mask. So when you touch it, you've picked it up with your hands.
And we see people do that
all the time. All the time. And then they say they've observed everything. I wore a mask, I did social distancing, but they didn't know the thing that is actually getting to them is something they are wearing on their faces.
What about those who use the non-surgical mask, the ones you can wash? We see people use it repeatedly without washing it.
No, that is also bad.
Okay.
Remember that as you wear this mask, that is why he said when you wear this disposable one, you should not use it the next day, you should throw it away. But once you wear within the first 24 hours or less, you wash the cloth ones, not only just washing, with copious soap, lathering properly, because the soap itself kills the virus. But on top of that, you should iron it. Once you do that, you can wear it so many times so far as you keep doing that. So that is very, very important. And then next thing is that when you wear the mask, you should not just drop it carelessly, because some might contain the virus. Anywhere you drop it, it will leave the virus there. So it's important to dispose it in a container that you can cover, or if possible, incinerate it.
That's for the disposable
That's for the disposable ones. For the other ones, of course, we've already explained it. Okay. And the other thing we want to talk about also about COVID is that initially, it's good to bring this to the fore. Initially, it was thought that most of the deaths are through respiratory distress. But some post-mortem that were done now confirm that there were also what we call thromboembolic events. That means blood clots within the arteries and even in the lungs, giving some what we call infarcts, dead tissue within the lungs.
Is that some of the new patterns in terms of new infections?
It's not a new infection.
New ways.
It's not that it is new.
Okay.
It's just that it's been discovered newly.
Okay.
So most of the sudden deaths, in case of so many mortalities that happened, people were ventilated. We thought that ventilation was it all, but it was later found out after post-mortem that it wasn't just a respiratory problem, that there were blood clotting problem. And that's why you see some people, they say, in the morning, he ate breakfast, he was coughing, in the evening, he's gone. The reason is that the thromboembolic episodes is actually blood clots. And then when they did the autopsies, they found the people, most of them didn't have what we call deep vein thrombosis, because that is usually the pattern. People have clotting in their lower part of their legs, and then the blood clot will travel and come and lodge in the artery between the heart and the lungs. and block blood supply. So, but this is what is happening within the lungs, and those thrombosis are the things that were causing the sudden deaths.
Well,
so it's important to know this.
Okay, Dr. Oji, thank you for that, because we just get to hear and see new theories of this virus daily. But ventilators is one of the critical equipment yes, used for managing COVID-19 patients. What is the situation for Nigeria from your observation?
Well, the situation in Nigeria is that so far a lot of people are not being ventilated. And then you see, it's not just to have a ventilator that is important. It's also important to have what we call an intensivist, somebody who is appropriately trained to use the ventilators, because it's not just any doctor. You have to be properly trained to be able to use it. And because if you don't use it properly, you kill the patients. And then this is a very highly contagious disease. Even the people using it, they don't use it well, they get themselves also infected. So as we speak, there's some ventilators in a place like Abuja. At least we'll have some ventilators in most of the treatment and isolation centers. What we're just trying to make sure that there are required doctors who will be able to use those ventilators. But like I said, the use of ventilators is not as frenzied as it was when this pandemic broke, because we found that a lot of the cases are actually not for ventilation. In fact, the new intervention is that once people come early, the problem is that people don't come early to the hospital. They stay in their houses treating themselves until they become very breathless, then they run to the hospitals. If they come early,
supposed to be.
It's not supposed to be. It's supposed to report and come to the hospital early. It's been found out that even people who have those problems, if they come early, they are given anticoagulants, but most importantly for the respiratory ones, if they are given what we call hyperbaric oxygen early enough, it might even obviate they are using ventilators in the long run.
Okay.
So early intervention, early testing, and return of the test early will save a lot of lives.
Will help prevent, but we know that facilities are getting overwhelmed because of increasing cases, especially community transmission, which we're hearing daily. What's your message to Nigerians as we round this off?
My message to Nigerians is that they should not, by any stretch of imagination, think that coronavirus is a conspiracy theory, that it is not real. It is real. It's killing people. It's making a lot of people ill. And then the important thing is that we have a youthful population. 70% of our population is not under the age of 30. So a lot of young people are moving around, taking the disease to their parents, to their grandparents. The people who die are people older and people with comorbidities. So whoever you are, we are in the same ecosystem. Everybody has a part to play. Protect yourself and protect others.
And it's very simple in the protection.
Wear the mask.
Just wear the mask.
Wash your hands. Stay. See, I'm so far away from you.
I'm safe.
I'm so safe, and I'm wearing mask. You're even safer.
Yes.
than me.
Thank you very much, Dr.
Thank you so much.
Ejike Oji. Thank you for sharing your thoughts with us. He's the Chairman, Medical Subcommittee, FCT Ministerial Expert Advisory Committee on COVID-19.